But our next speaker is Aoife Lawton, and a lot of people here will know Aoife, who works in the HSE and is the first National Health Services librarian. So Aoife, we're all really interested in hearing your perspective and what you have to tell us about your experience of the crisis and how you're planning in your sector as well into the future. So I'll hand over to you, and thank you, Aoife.
Great, I hope you can all see my screen here. I'm just going to go ahead. So the current, thank you all very much for showing leadership and organising this seminar and giving me the opportunity to explain the situation at the HSE end and how we are responding to this pandemic. So I'm going to try something a little bit different now, and hopefully this will work. Just want to make sure you're all there as I can. Let's see. Let me just stop my video here. Okay.
Space, the final frontier. These are the voyages of the HSE National Library Service. Its continuing mission, to turn knowledge into action, enabling care, improving health, to seek out new ways of working and new, innovative solutions, to boldly go where no one has gone before. Today's journey begins on Earth. The National HSE Librarian receives a command to redeploy all staff to public health due to a new virus which is invading the Earth called COVID-19. A business continuity plan and assessment of what should remain operational must be drawn up immediately.
So I have to gather my thoughts, and I know from the outset that people are going to need access to evidence-based resources online from any location, from any device. We may have to start building new online platforms, and I know that I have a couple of teams in place that I'll need to hold on to that will really make a huge difference to fighting COVID-19 in the days and weeks ahead. People are going to need access to synthesized, authoritative information, and that's going to be crucial in the age we live in of fake news. So I have 6 teams as part of our library strategy, and I know that 2 of these teams are going to have to really remain in place. And yeah?
Sorry, Aoife, we can't see your screen.
Oh, sorry. Apologies. I thought it wasn't working. Bear with me 1 second now. Can you hear me?
Yeah, we can hear you. Yeah, we can see your screen now, Aoife.
Oh, apologies for that.
No problem.
I'll keep going, will I?
Thanks, Aoife. Yeah, keep going.
I'm going to keep going. Apologies for the first few slides. Okay, you're with me. Great. I'll keep going. So in the early days of this, my manager, Dr. Anna Torres, who's the Assistant National Director of Research and Evidence, we had a number of conversations, but communication has been mentioned by other speakers today, and that was really important from the outset. So together we prepared a communication, and we decided that, you know, staff needed really to know what's happening now, what's happening next. And so Anna had asked me, well, you know, what's mission critical here? What can you hang on to? And what, like, basically everybody in the HSE is going to be redeployed from the bottom to the top of the organization. Our new business is COVID-19, and nothing else is happening for the foreseeable future. So I suppose I was in a slightly different situation to others in that I knew the vast majority of my staff were going to be redeployed. So that took a bit of thinking, and as I said earlier, the digital and evidence teams were the 2 leads that I really needed to hang on to, but I had to check in with individual staff members because everyone's personal circumstances in this crisis is different. So people have children, they're looking after elderly, etc., etc. So that was, these are things I really had to take into account going forward. And it was Friday the 13th of March when all of our staff in our various locations around Ireland received this joint communication that basically all our libraries had to prepare for closure, and all staff had to prepare for redeployment to public health. And the redeployment was going to last weeks or months. We didn't really quite know at that time, and we still don't. So that news was met with mixed reactions. I suppose fears for some returned who had previously been redeployed during the swine flu pandemic. Others went above and beyond, but overall there was an absolute willingness from all staff that we were in this together, and we had to work together and do whatever we could to fight COVID-19. From my perspective, I guess in the early days of this, in kind of mid-March, all of April, I was working every single day. Every day was a working day. Days were really long. I didn't know. I'm still not sure what day of the week it is, but it's gotten a little bit easier in the last couple of weeks. But it was really a very kind of intense time. And our response to COVID-19 was really all-consuming. So while we don't have as many staff as perhaps some of our academic and public colleagues, we have a lot of locations and we're national service. So we're also embedded within the health system, so it's quite a different perspective, I guess. But the redeployment took some time, and in fairness, my library managers assisted me with this throughout all locations. From national HR, they were ringing me every 2 days, wanting updates on staff, because I suppose the immediate priority was to redeploy staff to public health, for contact tracing, for the HSE helpline, for human resources, occupational health, you name it. So they were looking for everyone and anyone, all skills counted, everybody counted. So that was very just time consuming more than anything else. I think Marion mentioned this. So something unexpected then happened on St. Patrick's Day this year, when our Taoiseach mentioned librarians. I mean, this was really fantastic to hear our leader talk about us like this. And I'm sure you all felt the same. I mean, there was a sense of kind of pride. There was a recognition. I think he certainly helped with our response in the HSE, because he was winning hearts and minds. And, I got a lot of text messages that night, and everybody felt, a sense of pride in that. Dr. Therese then put in operational teams in a very short space of time. So I spoke about the evidence team that we have and the digital team. So the two leads there are Brendan and Laura, who really got into gear, and we all worked collaboratively to put a new shape on what we were going to do in our response. So Anna came up with this diagram. It's kind of a complex operational workflow. And in the yellow, you'll see the 3 teams. So the evidence team, that's mainly librarians. The clinical guidelines content team, I was on that with a couple of other medical colleagues. And then there's an IT team. And then the end result of this actually turned out to be a LibGuide. Down there in the bottom, you see the orange one. And behind the scenes of this, we established links between the library, research and evidence, and a division in the HSE called Clinical Design and Innovation. So they're part of Dr. Henry's office, the Chief Clinical Officer, who you've probably seen numerous times at this stage on RT briefings. So, our media briefings, I should say. So they wanted, one of the immediate things that the clinical community needed was guidance on every area of COVID-19. We weren't obviously producing the guidance, the clinicians are, but they needed a digital platform accessible, especially on mobile devices, immediately. So we worked collaboratively to deliver that. So I spoke to Brendan, and it was clear now that staff were being redeployed, that we were going to need extra resources for the evidence team. I put out a call through the Library. It was great being on the Library Council, the Library Association of Ireland. That's a fantastic link to have, and the Health Science Libraries Group list. And there was a fantastic response. Librarians from other sectors are still working with us on this, and there's a huge amount of expertise in Ireland when it comes to advanced searching. Not to be underestimated how important this is right now and in the future. And then when it came to, what this evidence team were doing, we're literally searching for the latest in literature about COVID-19, based on questions that are received from clinicians, and then synthesizing and summarizing that evidence. And we needed to get clinical input on some of the summarizing. So that was something that happened in the early days, and we've been working on that. So Brendan and his team came up with a COVID-19 search protocol, which is published on our HSE library website. And this repository I've been talking about then was launched in April, and broadcast email was sent out to over 65,000 staff about it. And you might recognize the kind of platform we're using here. It's actually LibGuides, which has proven to be a very worthwhile investment for us. I'm sure it has been for you also. As a platform, it works very well. It's quite flexible, and it works very well on mobile devices, which was very important for our community. So it received quite a lot of hits, and it got a mention in the Irish government COVID-19 briefing on Easter Monday, and I think it's been mentioned since. It's been sponsored by Siobhan Ivreen, who I think has been also in the media. So regarding then the kind of operational workflow, we've set up an editorial daily call using Slack, and this happens, we get all these requests in from clinicians and from national clinical programs in different areas of COVID-19 they're looking for evidence on. So then this call takes place between multidisciplinary team, librarians, researchers and clinicians, and they triage the questions received on a daily basis and decide, what needs to happen and which needs an evidence summary and which just needs a different response. And then I've been checking in with Laura, head of digital. So there's so much really that goes on behind the scenes, and Laura kind of used the analogy of a light bulb. It's something you just completely take for granted, but when it goes off, you kind of go, you really feel the impact of that. And technology is no different. There's an awful lot of work that goes on behind the scenes, keeping our platforms up and running. And this was so important right now and in the future, that people have access to information. And luckily, Laura had put in place a system called Slack prior to all of this, and which not everybody was using, I have to say, but now absolutely everyone's using it. So that has been good. And it enables us to bring in non-HSE librarians and other non-HSE clinicians and wider HSE teams to use this platform. And we have a systems librarian, Thomas, who's been working on a LibBot as part of a new virtual reference desk offering. And I'll talk about that a little bit later on. So in turn, you're all kind of familiar with these acronyms now at this stage. The NEFIT group, they have a subgroup on guidance and evidence synthesis. So I have to send in weekly updates to the Department of Health on that. And I mean, there's other people in the wider health sector and academic sector producing evidence, summaries of evidence, etc. HICWA notably being one, and I know the RCSI and the HRB are working in probably other academic libraries on this in this space. But ours are summaries of evidence, and you'll see there's 46 there, but that's actually double now since this is done. We're more up into the 80. So these summaries take a lot of time to do in the background. So it's been a phenomenal, really, with all the librarians working on this. It's been a really a superb response. Oh, I forgot to say that Gethin, who's kind of deputy lead on the evidence team, has pointed out something really significant. I mean, there's a paucity of good quality evidence when it comes to COVID-19. So, in library and health library circles, we talk about the pyramid of evidence. So at the top of the pyramid, you get things like systematic reviews, but there's no systematic reviews on COVID-19. So people are having to make decisions on low quality and low availability of evidence. Things like case studies, which in normal circumstances, you wouldn't even really consider. So that's just the reality we're faced with in a pandemic situation. From a staff morale point of view and just keeping communication channels open and people connected to each other, I started weekly Friday management calls with my team. Now, my managers are redeployed, so not everybody can check in, but when they can, it's been really beneficial. And we've migrated from Slack to Zoom, although you wouldn't think I'm that familiar with it. I haven't actually been using it that long. And one of the benefits of working in the health service is that we've access to healthcare professionals, And Mary Morrissey is a clinical psychologist who has joined our teams, and she's just given us 1 to 2 self-care exercises on these calls, which I think have been very beneficial for all of us, just to take a mental break from this. And the health and well-being and self-care is extremely important at this time. And I just thought it was funny, there's a picture of a cat there. I don't know about yourselves, but there's a lot of cats appearing in our kind of social media platforms like Slack. I don't know what it is about librarians and pets. Anyway, on another note, I was invited then to link in with a 5 nations knowledge exchange group I'm involved with. So Scotland, England, Wales, Northern Ireland, and just there last week. And we had a call, and they wanted to know, well, what's working well and what could be improved. So I thought it would be interesting just to share that also with you all. So from my point of view, leadership has been very important from all levels of all organizations. And we've seen some of that. And I think Marion mentioned that, people react differently under times of stress, and I have certainly seen that. It's a real test of character at the moment. I think having a plan has been important, like, having a strategic plan has been actually very useful, because I've been able to translate it into practice. And having some of those teams already set up in a virtual way has been hugely beneficial. So the library staff response has been great. It's given us an opportunity to integrate our work more strategically into the HSE and to work with colleagues in a new way, and really heightened people's awareness of what it is that we actually do in the library service and the value of our very unique skills at this time. Like, clinicians literally just do not have time to search for the amount of evidence out there, or literature out there on COVID-19. They just don't have the time at the moment. It's all hands on deck. So technology equally has been, it's been up and down, but Slack certainly has been a success story for us. So it enables virtual working, remote working, people working on different teams, and the integration of teams with each other, general channels, all the rest of it. So that has been really good. There's been talk of pets and home haircuts and things like that. And I suppose the light tone that Marion mentioned, I think that's very important too. It's all about people working alone but together, and this platform has helped and enabled that. So, keeping everyone's spirits up and making the best use of our skills at this time and has been really good. And Slack has also enabled us to deliver some sort of CPD. And I think Alan mentioned the amount of open access resources being thrown at us at the moment. And yeah, that is equally a concern for me going forward. What happens when, they switch it off in June or whatever, and people have gotten used to using them, and perhaps they have been something that people maybe even relying on. So that's a whole other challenge coming down the road. So my colleagues across the water were asking what I think could be improved. So I suppose the remote working infrastructure, we weren't that ready for that. We did have our virtual team set up, but they weren't working from home. And rural broadband, it has to be said, is really, depending on where you are in the country right now. Some of my staff don't even have mobile coverage where they live. So that's been a really big challenge for people. So some staff have had to go back into work, even though really I don't want anyone going into a physical hospital at the moment, bearing in mind the majority of our libraries are based in hospitals, high-risk areas. The operational redeployment response certainly could have been improved. It was a bit like firefighting in the beginning and crisis management, and it's nobody's fault. That's just the world we found ourselves in. Was anybody really kind of ready for this? I think Marion said it wasn't something you could ever plan for, and there's definitely some truth in that. And here's my line, and apologies, you missed the first couple of slides, but it's a pandemic, but not as we know it. And if we look at the data for Ireland and our experience of previous pandemics during our lifetime, it must be said, we saw SARS in 2002, 2004. And there were 0 fatalities in Ireland. The control measures the public health put in place, like active case finding and infection control, that remains true for any pandemic. So we're seeing a lot of that again. the bird flu of 2007, there were 0 human cases in Ireland, although there was a couple of deaths in Turkey and Europe. So it's really not comparable. And then the swine flu, our paraprofessional staff were redeployed to vaccination clinics. One thing we did during that pandemic was we installed hand sanitizers at entrances and exits of libraries in the east of Ireland for sure, and that has paid off because they are really useful again today and everyone's using them. So this new virus, COVID-19, as I said, it's not something we've ever seen before in our lifetime, or hopefully won't see again. So that was a snapshot of you know, the statistics that are churned out every day. Becomes quite a difficult thing for people to digest, I think, because we are, you know, there's people behind every single one of those figures. So it's a hard thing to really contemplate. But unfortunately, those deaths are going up, and that's the reality of the world we are in today. I don't think many of us have talked about the future, but this Minnesota study I thought was interesting, where they described 3 types of peaks, and they talk about the future in waves. And you know, we're talking about years here, so you know, this idea of the government plan of easing restrictions, etc. You know, there's a pre-COVID world and then there's a COVID world, and that's it. I'm not sure that there is a post-COVID world, and I think our national consciousness needs to recognize that at some stage, albeit a difficult thing to swallow. So we need to prepare ourselves for, you know, the longer term months of this COVID-19 activity, and all we can do is work together to do the best we can. So in terms of our next steps, well, we have to keep going, keep the chin up. In terms of library response, try and get a virtual reference desk team. Well, actually, Laura's been successful in pulling a library assistant, senior library assistants, and that for one reason or another are working from home. As I said at the beginning, people are in difficult and different circumstances, so we're trying to do our best for everybody. So that team has been pulled together, and we're testing out LibChat and LibBot functions, and that's hopefully going to be launched next week. So that's going to be very positive for our users. I have to monitor redeployments ongoing, and it'll be a challenge to get people back to library work. We have a knowledge broker team, which I'd like to reinstate, and then plan to hopefully reopen at some stage or continue a new normal. And I think personally a challenge for us in the HSE would be to reclaim our library spaces, because our spaces currently are being used by clinicians in the main, so they're being used as respite areas. Every physical inch of a hospital building at the moment is really very precious. So some other libraries are being used to facilitate physical distance working for clinicians, etc. And my own office is overtaken by public health managers and contact tracers, army cadets, you name it, are in our buildings. So that's a unique challenge perhaps that I have in the HSE and my managers that work with me. So I think we will all continue to work behind the scenes to deliver better outcomes for patient care through supplying frontline staff with evidence summaries, point of care tools and learning resources. And
to be continued.
Thank you.
Thank you, Aoife. Aoife, would you like to show the video that we didn't get to see at the start now before we finish?
Yeah, sorry about that. It wasn't actually a video, it was just a voiceover. Did you hear the voiceover?
No, yeah, we heard the voiceover. I didn't know if you had a video or slides to share, or if it was audio, but if you have anything you'd like to show, if you have video and you want to show it, we can do it now before we finish up, or if you don't, that's fine too.
It was just
Okay.
it was just that one. Can you see that?
Okay,
It was
yeah.
just that and that.
Very
Apologies for that
good. Okay,
beginning.
no problem, Aoife, and thank you. And